Hi, my name is Natalie Fine, and today I'm going to be presenting for you Careers for Empaths. The definition, the trademark of an empath is feeling and absorbing other people's emotions and or physical symptoms because of their high sensitivities. Empaths tend to feel their feelings more intensely. Criticized and misunderstood by some, this is the empath's superpower. Traits of an empath. Empaths are highly sensitive. They absorb other people's emotions. Many empaths are introverted. They are highly intuitive. They often need alone time. They can become overwhelmed in intimate relationships. They are targets for energy vampires because they absorb other people's strong emotions. Empaths become replenished in nature. Empaths have highly tuned senses. Empaths have huge hearts, but sometimes they give too much. Empaths will change the world for the better. Now, my working definition of an empath is someone who's in touch with their and other people's emotions, who want to help people as a career or part of their everyday life. This is a way for me to characterize students who want to help people, so you can see the many ways that will allow you to use your empathic skills to help people and do good. Now, empathy is the ability to recognize, understand, and share the thoughts and feelings of another person, animal, or fictional character. Developing empathy is crucial for establishing relationships and behaving compassionately. It involves experiencing another person's point of view rather than just one's own, and enables pro-social or helping behaviors that come from within rather than being forced. This is important because it helps us understand how others are feeling so we can respond appropriately to the situation. Research shows that greater empathy leads to more helping behavior. Typical major for empaths: behavioral health and human services, education, liberal arts, the social behavioral sciences option, nursing, psychology, recovery and transformation certificate, recovery leadership certificate, and really any major. Now, what should I major in if I'm an empath or if I want to help people? It really depends on your long-term goal. Some careers have very specific education path or requirements, and if you're unsure, you'd probably be best choosing a very broad major. I really like this quote from Alanis Morissette because so often empathic people are judged, they're deemed too sensitive. Being a sensitive empath is a beautiful thing as an artist. I think being a sensitive is the empath's superpower that is going to enable you to really do good to change the world. Look at all the possible different careers: addictions counselor, applied behavioral analysis, art therapy, case manager, child and family advocate, clinical psychologist, child welfare, clergy, community advocate, community outreach, counselor, court liaison, crisis intervention, diversity and inclusion specialist, education, employee assistance counselor, gerontology, healthcare, healthcare educator, hospice care, human resources, human services, labor relations, a lawyer or a mediator, librarian, marriage and family therapist, mental health counselor, music therapy, nonprofits, recreation therapy, rehabilitation counselor, parole or probation officer, psychologist, psychiatrist, social work, substance abuse counselor, therapist, veteran affairs, vocational rehabilitation counselor, and there's so much more that you can do in this field. Now, differences between social work, counseling, and psychology. Often a student will come to me and say they want a counselor or they want to be a therapist. And there's several different ways that you can achieve that. There isn't only one way, there isn't only one major to accomplish this. Counselors typically focus on helping families and individuals with a specific set of problems, particularly patients with mental health disorders. Specialties include school counseling, marriage and family therapy, rehabilitation counseling, vocational or career counseling, clinical mental health counseling, and substance abuse counseling. Social workers focus on providing a wider range of services in social services systems. A career in social work, on the other hand, can be much broader. Social workers can pursue jobs in clinical settings, government organization, social administration, public policy, research, ethics, and as well as schools. Social workers focus on finding solutions to systemic problems, as well as helping smaller communities that are affected by those problems. Lastly, psychologists assist families and individuals by observing behavior and applying theories that they feel will best help those families. Typically, psychologists also have a more extensive research based background. All the above can counsel and become licensed therapists. The big difference is in the settings, population, type of counseling, and depending on the state, what are the licensing requirements and eligibility for medical insurance reimbursements. Possible employers: education and childcare, college or universities, mental health systems, correctional systems, schools, substance abuse clinics, hospitals, labor unions, employee assistance programs, youth and family services, Department of Human Services, civil rights commissions, veteran affairs, crime victim assistance programs, police departments, charities, child welfare organizations, Social Security Administration, Office on Unemployment and Compensation, and many more possible employers. The typical GPA requirements for both social work masters and counseling masters are usually between a 2.75 to a 3.0 at the minimum. The preferred undergraduate degree is psychology, education, social work, sociology, or the behavioral sciences. Those with a bachelor's in social work might be able to receive advanced standing into an MSW program, Masters of Social Work, which will mean less time to earn a master's degree. And master's degrees are necessary for both to advance and to do therapy. There are many social work specialties. There's social workers in administration, policy, and research, child, family, and school social workers, community social workers, child welfare, criminal justice social workers, gerontological social workers, medical and hospital social workers, mental health and substance abuse social workers, military and veteran social work, palliative and hospice social work, psychiatric social workers, and I mentioned again, school social work. These positions are often in high demand for candidates, but the positions can be scarce because each school might only have one counselor, one social worker, excuse me. Counseling specialties, to name a few: addictions counseling, career counseling, clinical mental health counseling, clinical rehabilitation counseling, marriage, couple, and family counseling, rehabilitation counseling, school counseling, counseling in a higher education environment, community counseling, and gerontological counseling. Now, often students confuse the differences between a psychologist and a psychiatrist since they sound so similar. Psychiatrists are medical doctors, psychologists are not. Psychiatrists can prescribe medication, psychologists cannot. Psychiatrists diagnose illness, manage treatment, and provide a wide range of therapies for complex and serious mental illnesses. Psychologists can also diagnose but focus on providing psychotherapy or talk therapy to help patients. Both psychiatrists and psychologists understand how the brain works, our emotions, feelings, and thoughts. Psychiatrists attend medical school and become medical doctors before doing specialist training in mental health. Because they are doctors, psychiatrists understand the links between mental and physical problems. They can also prescribe medication. Psychiatrists operate according to a medical model. Things to consider. Empaths feel deeply, so it is important to develop coping strategies so you don't take on too much pain from others and/or experience burnout. How much time are you able to dedicate to your schooling? You can use your empathy skills in any career, in or out of your work life. Work-life balance is important. You can't help others if you don't take care of yourself. It's important to set boundaries. Now, preparing for your helping career, knowing another language is a huge advantage. If you're not fluent in another language, I would encourage you to take as many languages as you can. Do your research so you know what the outlook of the career is like. What do you need to do? How long will it take? Job shadowing or informational interviews. Observe what it's like in the field. Internships and volunteers so you know what the field is like and what you can expect your job to be. Thank you for watching. Again, my name is Natalie Fine. If you have any questions, you can email counseling@ccp.edu.